across Tasmania. This is Tas News 24 with Kane Dello.
Every indication that the world will soon enter a pandemic phase of the coronavirus. And as a result, we've agreed today and initiated the implementation of the coronavirus emergency response plan.
Hello and welcome to this special edition of Tas News 24. Tonight we take a look at how the coronavirus started and how it ended up in Australia and of course right here in Tasmania. We hope this episode will give you a better understanding of the virus and help you prepare for whatever the next stages may be. The coronavirus has dominated global headlines and closed borders, but when it comes to their personal worries, Australians are turning to the internet for answers. The top searches on Google over the past week suggest many of us want to keep on top of how the disease spreads, as well as practical questions about how to best protect ourselves. But just how did the coronavirus start? Well, in December of 2019, there were a cluster of pneumonia cases in China. Investigations found it was caused by a previously unknown virus, now named the 2019 novel coronavirus. Coronaviruses is a large group of viruses that consist of a core genetic material surrounded by an envelope with protein spikes. This gives it its appearance of a crown, and crown in Latin is called corona, and that's how the viruses get their name. There are many different types of coronaviruses that can cause respiratory symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome, or also known as SARS, which was first identified in China in 2003. And the Middle East Respiratory Syndrome, also known as MERS, which was identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who had been associated with the seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and to a number of other countries. The most asked question, where did the virus come from? Well, it's known the coronavirus circulated in a range of animals, and sometimes these viruses can make the jump from animal to humans in what is called a spillover, and could be due to a number of factors, including mutations within the virus or increased contact between human and animals. The exact dynamics of the transmission of the virus is yet to be determined, but respiratory viruses are usually transmitted through droplets created when an affected person coughs or sneezes, or touching objects that can be contaminated with the virus. There can be a number of symptoms ranging from mild to severe. There can be a fever, respiratory problems including cough, shortness of breath, and in most severe cases there has been pneumonia, kidney failure and death. The mortality rate is not known yet. The steps in being diagnosed with coronavirus can be done through a test called PCR. This test identifies the virus based on the genetic fingerprint. Currently, there is no medication for the virus and treatment is supportive care. There is no vaccine against the virus at this stage, but treatment and vaccines are in development stages. Prevention of the virus comes down to good personal hygiene. Most important thing you can do to reduce the risk, which starts with regular hand washing, which research shows can significantly help to prevent the spread of infection. It's also important to avoid touching your face, especially if you haven't washed your hands, and to clean and disinfect frequently touched objects and surfaces. The Prime Minister Scott Morrison has said Australia is treating this as a global pandemic and the nation is ready to tackle this virus and has prepared an emergency response plan. On Monday, the Premier of Tasmania, Peter Gutwein, addressed the media and stated the first case of the coronavirus was present in Tasmania, after a 40-year-old man who travelled from Iran through to Malaysia, then on to Melbourne, and finally arriving in Launceston Airport on Sunday, had tested positive to the coronavirus. The man had told healthcare staff that he felt feverish while he was in Iran. It's been said the man stated he self-isolated when he presented himself to the Launceston General Hospital. But after further investigations, it has been stated the man actually broke his self-isolation and went shopping at the Woolworths supermarket on Sunday evening in Launceston while waiting for his test results. The second concerning factor is that hospital management of the LGH allowed the man to leave knowing he presented himself to the hospital after feeling unwell and had told them of where he had been on his travels from overseas and felt he could possibly have the coronavirus. This is concerning that Tasmania's health management can be so careless when treating a person who presented symptoms of the coronavirus. The man should have remained in isolation in the hospital and not be permitted to do some shopping while he awaits for his test results. It calls on the Health Minister Sarah Courtenay to step up and provide regular updates to the people of Tasmania. The Health Department have stated people shopping at the time the man was present in the store would be low risk. However, the government has failed to tell us if the man was wearing a face mask while he was in the store and how fast did the action plan take place for the store to implement cleaning and wiping down of self-service checkout areas he may have used, or how quick staff were to be notified of the man's condition. This has been declared as a global pandemic by Australia, and it's time our government takes this matter seriously. After all, people's lives are being put at risk, and it's time the government, including the Health Minister, start acting in the roles they are paid top dollar for. So many things are slipping through the cracks, and if the government don't get on top of it now, the situation will only get worse. In the meantime, it's been advised people take precautions and keep your personal hygiene to high standards to guard against the virus. We hope the information we have provided you this evening will answer some of your questions. We would also like to thank the Royal Australian College of General Practitioners for their helpful information they provided to us. We will continue to keep you updated with any new information we may receive, and don't forget you can stay up to date via our Facebook page and our website at tasnews24.net. Also, feel free to send us an email anytime at news@tasnews24.net. Until next time, take care of yourself and others. Bye for now.